Hi everyone, welcome back to the channel. So, if you are a doctor or a final year medical student or an intern who is confused between whether you should be choosing UPSC CMS or the PG Residency, this video is for you. So, let's break it down all clearly and practically what will suit best for you. One offers the job security and balance, the other offers the specialization. So let's dive deep into it. So UPSC CMS or Combined Medical Services is an examination conducted by the UPSC to recruit the medical officers into various central health organizations like railways, CGHS, CHS, NDMC and others. While the PG residency is the traditional route all the MBBS graduates opt for the specialization. So let's start with what the lifestyle looks like as a UPSC CMS medical officer. Once you clear the examination, you will be posted to any of the department. If you get the cadre 1, you will be posted in the CHS wellness centers, and if you get the cadre 2, you can be getting NDMC or railways. So the working hours are moreover similar. It's 7:30 to 2 o'clock in most of the places. So basically it's a 6 to 7 hours duty, and your day revolves mostly around the OPD consultations, some basic administrative works and the preventive health workups. Now let's talk about the salary of the starting salary of the UPSC CMS medical officer is around 90,000 to 1,20,000. So it also depends on the city you are in. In tier 1 city, you can be getting around 1.15 to 1.20, and if you are in tier 2 or tier 3 cities, it could range around 90 to 1 lakh. So it's a very stable, very structured, respectable government job with time bound promotions and increments, and you get all the perks of being a central government employee. Like you will be getting pension, HRA, DA, all the allowances, like you get travel allowance, you get convenience allowance, and there are certain more allowances like newspaper allowance and briefcase allowance. I'm not aware of certain others, but these are the basic ones. You will be a gazetted officers, level A, class A officers, and your pay level starts from level 10. So it is the highest pay level any government position should start with. So you are getting a highest pay level. So now let's see the advantage of UPSC CMS medical officer one by one. Number one is that you start earning very early. If you are in a final year or internship, after completing the internship you can join the services and start earning. So it gives you financial stability very early in your age. Secondly, it is a permanent job. It is not a contractual basis job, so you get job security. Thirdly, that there are fixed working hours, there are no emergencies or night calls, so pretty good work life balance you can get. And fourth is that you can still pursue your PG after 3 years of completion of the service. You can get the study leave, or after the 5 years you can get sponsored seat in the central institutes like AIMS, JIPMER and PGI. So your job security comes in your hand, your financial security comes in your hand, and if you want that enthusiasm in the clinical work, you can go for your PG also. But let's come to the cons part also. Like everything has its drawbacks, so this job has also. Number one, it has a very limited clinical exposures. You might not get very complicated or complex cases. You might not able to do those procedures you always wanted to do in your UG. So you have to make a compromise on that. Secondly, the promotions might be slow and seniority based. Third, this job is transferable. You might get transferred to another city, though it is a very rare thing to happen. But like in Delhi, you have most of the wellness centers, so even if you get transferred, you will be staying in Delhi only. So Yes, this might be a drawback. And fourth is that some postings may be in remote areas, though very rare. Maybe in a railway cadre it can happen, not in the CGHS. And what another drawback is that once you get into this um, comfortable lifestyle, going back to that study phase for pursuing PG might be difficult. Not impossible, but might be difficult. So that's the life of the UPSC CMS medical officers. Very secure, predictable, but sometimes routine also. Now let's get to the other side of the coin, which is the PG residency. Most of the MBBS graduates opting for 3 years of intense clinical training, academics, research, toxicity. It's very extensively burning out, but yet very transformative journey also. Let's get into the pros and cons of the PG residency. First advantage is that you are specializing in a branch. You get deep clinical expertise in that branch. You might opt for the super specialization after completing the PG. What a drawback is that, like, the path to the super specialization itself is not that easy, but you can take it into the pros or cons. It's your wish. Fourth is that it gives you a path for the private practice, which is not allowed in the UPSC CMS. And it can also, like, increase the chances of your earning in the long term. Like, you are not bound to the government, so it's a totally different path. And also the professional recognition as a specialist, it gives you a different kind of confidence. But let's not forget, this path has also the cons of its own, which is unpredictable working hours, extensive night duties, emergency calls, the pressure from the professors, the toxicity of the senior residents. I don't know whether I should be calling that out or not, but truth is truth, okay? And in most of the states, the PG residents are underpaid. Like, if we go out for an average, it's around 60,000 to 90,000 in most of the states. Some states might be paying well enough, like Rajasthan, but if you go to the southern states, they are paying around 50 to 90, I guess. Thirdly, even after completing the PG, your future might not be secured. Like, after completing the PG, you will have to find a workplace, right? And corporate jobs are becoming difficult day by day. Basically, in metro cities, there are so many super specialists here that the PG residents are finding it difficult. So let's compare both side by sides. In terms of the working hours, UPSC CMS has fixed working hours, and PG life, or maybe even after PG, there are no fixed life. Income is pretty decent here. In the other part, in residency, you get a fixed stipend, mostly underpaid, but after completing the PG, of course, there are, like, a lot of doors you get, whichever you want to go into. And thirdly, lifestyle. It has a balanced lifestyle, while the lifestyle in the residency or post residency, it might not be that much balanced. In terms of growth, let's get into that. In terms of growth, the UPSC CMS might be not so good, but you get a lot of clinical growth in the PG path. Thirdly, if we get into the job security, the UPSC CMS has a pretty decent job security, while the PG path, you might be uncertain about your job profile even after completing the PG. Like, you might have to struggle for getting SR-ship, and even if you get SR-ship, there is a lot of competition going for becoming AP. So it's a never ending path, basically. You might be in your 40s or 30s and still figuring out where I need to go. So it's a never ending hustle, okay? So, if you value stability, fixed hours, and peaceful time, the UPSC CMS is a very good option for you. But if you are that enthusiastic, passionate about the clinical growth, clinical skills, and long-term earning potential, then you should choose the PG residency path. Both paths are respected. It just depends what are your goals, your personality, um, um, your lookout for the life. So you have to choose according to that. Personally, I was the person, I could not handle that that long working hours and that toxicity, so I did not opted for the PG residency. I wanted a peaceful life, a balanced life, so I came here. But if it suits you as well, you might go for it. But if you want to have that clinical expertise, you want to get that recognition as a specialist, you should be opting for the PG residency. And if you want to have both, congratulations, you can get into the UPSC CMS and then complete your 3 years of service, and then go for examinations, get the study leave. Or if you have a very patient kind of personality, you can wait for 5 years, get sponsored seat, get your PG, come back, serve the government, and then do whatever you want to do. So if this video is helpful to you, please like. If you have any doubts, drop them into the comment box, and subscribe.